There's quite a bit of research. The biggest area that's been growing is in the area of the incorporation of imaging into prostate cancer and helping use imaging to guide prostate cancer. So the way we used to diagnose prostate cancer is if we saw that the PSA was high, we would do a kind of like a grid random sampling of the gland. And so if you have the gland, you would just kind of randomly sample the whole gland. And that was because we really didn't have a better way to target the areas of concern. But MRI technology has really improved in the last 10 years. And now we can get these MRI scans that give us really nice images of where the tumor is. And so then what we can do is, instead of just doing a kind of a blanket random sampling of the gland, we can do targeted sampling. So I actually have an example here of how that works. So here we have a patient where the patient got an MRI, and this outline in purple is the prostate. Outlined in green here is the area that we were concerned about. And so what traditionally we would have done is we would have sampled this area and just every little area in the prostate, and we would have hoped that we would have gotten this sample of this green area. But now with this targeted approach, we can get a bunch of samples from the green area. And so when that's done, you can see this is a prostate that has been sampled. And actually I showed you the green area, and then there was these blue areas were also of concern, so we also sampled those areas. But you can see how we did the standard biopsy where we just sampled the whole prostate, and you can see those areas just kind of sampled randomly throughout the prostate. And then we sampled the area pretty heavily that we were concerned about. And when we do that, we were able to find clinically significant aggressive cancer in the area that was, we fortunately did not miss because we were able to get good sampling. Now that we have an idea of image of where the cancer is in the prostate, we can actually talk about treating just the part of the prostate that has tumor in it, and avoid treating parts of the prostate that doesn't have tumor in it. So it's really opened up the field of research for focal therapy, where we're just going to try to treat part of the prostate and not the whole prostate. That's kind of a new emerging area. Some of the other areas of research we're talking about, we're trying to improve how we do the MRI. So we're talking, over here we're developing a trial to do metabolic MRI, which is a next generation of MRI, if you will, and uses tumor metabolism information to further identify areas that are concerning. We're also looking into using prostate cancer vaccine therapy to try to treat prostate cancer, just like you can use vaccines to treat or prevent infectious diseases. They're looking at vaccines for cancer now. One more study that we're doing here that's of interest is we're looking at the effects of diet on prostate cancer, particularly in men where we're just keeping an eye on the prostate cancer. A common question people ask me is, how can I prevent this cancer from getting worse? And one idea that we've had is we know that prostate cancer has a different metabolism than normal cells. Cancer grows faster than normal cells and therefore has like a higher metabolism than normal cells. We want to take advantage of that and see if we can target a weak point in the metabolism of prostate cancer. And so in collaboration with radiation oncology and personalized medicine here, we have a trial going now where we're using a special type of diet, a ketogenic diet it's called, to target prostate cancer and see if we can change the metabolism in prostate cancer or affect the prostate cancer simply by changing the foods the person eats. And so that is, that's along the lines of some of the other things I talked about, like the metabolic MRI, where we similarly use metabolism information to find the cancer. And this is all part of a really fastly emerging area called metabolomics, where we're just studying metabolism to better understand cancer. The ketogenic diet is kind of like a very strict low-carb diet. And what it does is when you starve the body of carbs, the body has to use other energy sources. And what it can start using is fat. So it's a great way to lose weight. But in addition to that, it turns out that prostate cancer is also, it doesn't actually care about carbs. Just like people can live off of carbs and fats, cancer also has to pick an energy source. And so prostate cancer actually lives off of fat. So if you convert the person's metabolism to fat using metabolism, what happens is it starts competing with the cancer. At least that's the thought, and it may limit the growth of the cancer. Is what we're hoping.